My name is Renee Wizik-Barrios. I'm with the Greater Houston Community Foundation. We really appreciate you spending this time with us, and we know that this wasn't a lot of notice with which you received the invitation, so we appreciate it even more because of that. Let me go through a few logistics before we get into the focus of the webinar. So we'll be doing Q&A a few different times throughout the presentation. We absolutely want to make sure you leave this presentation and discussion understanding the information. We're also recording this so we can share it afterwards, and if you want to share it with other networks, this is information we're trying to get broadly to the community, so feel free to distribute it broadly. So let me just say, we greatly appreciate you spending time with us. Our focus today is really to talk about the Harris County COVID-19 Relief Fund, which I think everybody knows by this point the Greater Houston Community Foundation is administering. And we take this obligation very, very seriously. We are really committed to trying to make sure that this $30 million get into the hands of the most vulnerable in our community, and we'll talk a lot about that in a moment. We believe that all of your organizations are really important to the fabric of our community in so many ways. We know that you're organizations who work with vulnerable populations. We know that you are all organizations that are really committed to equity, that you care very much for our neighbors as we do. And so we're reaching out to you because we want you to understand this information, but also we think that if you are willing to, you can have an important role to play in spreading the word and increasing our outreach to our community members at this very difficult time. I also just want to say, I know that this is a time of great stress for community-based organizations. Our whole community and our whole nonprofit sector has been really feeling the deep effects of the COVID pandemic, whether they're feeling it personally because of family members who are impacted, or whether we're just feeling it for our neighbors because of all of the job loss, all of the medical concerns, and all of that. So we know that your organizations are working under difficult conditions right now. On top of that, obviously, we know that everyone in, I would presume is extremely upset about the George Floyd killing. We know that this is an important time for racial justice movements in our community, and we realize that most of you play an active role in those movements as well. So I just want to say that we sympathize with the fact that you are extremely busy. Your time is really valuable. The role you play in our communities is extremely important. And we know that anything we're asking for you to participate in is totally voluntary, and that some of you may feel that you don't have the space or time under limited circumstances to participate. But for those of you who do want to participate, we want to actively engage with you. And if you choose that you don't have the time to do so, at least hopefully if you get more information about the fund and its processes, you might be able to answer questions for someone else who needs that information. So let me just dive in to go back to the agenda slide for 1 second, Allison. Okay, just real quickly. So that was our welcome and focus. I'm going to take you through the Harris County COVID Relief Fund overview. Then we'll do some Q&A. Then Elena White with Connective, formerly known as Harvey Home Connect, will talk about the intake process. We'll do some more Q&A, and then we'll get into outreach plans and discussion and next steps. So that's just where we're headed, big picture. All right, so now to the overview. So if you've been following the news, you may already know this is a $30 million fund for low-income Harris County residents. It is local general dollars. Many people have wondered if it's federal funds. It is specifically local funding. The whole purpose is to provide direct, flexible, emergency financial assistance to targeted vulnerable populations. And we'll talk a lot about the eligibility, but in terms of vulnerable populations, the county has really prioritized reaching immigrants, mixed status households, people who would not have otherwise qualified for CARES Act or stimulus money, including people who are limited English proficient, people who are disabled, people who are human trafficking survivors, people who are homeless, youth who've aged out of foster care, domestic violence survivors, along with anyone else who meets the eligibility criteria, which we will go through in just a moment. It is direct assistance. What that means is, think of it like the stimulus. Everyone is getting the same amount, and it's dependent on household size. So if there is a household of 1 to 4 people, they are receiving $1,200. If it is a household of 5 or more, they are receiving $1,500. This has been a big shift for the nonprofit community because a lot of our nonprofits are used to saying, let me see your rent bill, let me see your utility bill, and based on that, we're going to mete out how much assistance you get. This program was designed very specifically to have standard levels of assistance, because based on all of the research, which likely almost all of you are familiar with, there's been multiple national and international studies that show direct financial assistance to people in crisis is the most effective way to help families, that they know how to spend the funds and they don't need Big Brother, whether that's in the form of a nonprofit or anyone else counting their bills. So this is direct assistance. We'll go through the eligibility documents in just a minute, but they're very specific, they're very standard, they're not open to interpretation because we wanted to make sure everyone was being treated equally. It is a two-pronged process, which we'll talk about in a minute. We've already made $15 million in grants to community-based organizations. And then what we're going to spend most of our time talking about with you is the $15 million that will go through public intake and matching the community-based organizations next week. I think people know we are also administering the private COVID-19, Greater Houston COVID-19 Recovery Fund with our partners at United Way. And while we are leveraging the knowledge and the work from that fund, because we've done grant making and so we know community-based organizations who are already operating, this is distinct and separate completely. And the assistance is really coming through low barrier methods. So one of the things we'd heard a lot from feedback loops in the community is that we want to make sure that in providing this assistance, it's not done in a way that makes it more difficult for people who are unbanked or undocumented, et cetera. So we've provided a lot of really clear ways that people can access very cheap prepaid debit cards or ATM cards, or work with credit unions to have checks where no check cashing fees are required, et cetera. So we're committed to making sure that the people receiving the funds are not paying any fees in order to receive them. I'm going to take you real quickly to the COVID website, the Harris County Relief website, before we go to the timeline, Allison. I just want to point out that everything we're going to go through on this slide deck is pretty much on the website in a really easy form to follow. It was just easier in a presentation to use a slide deck, but it's got the dates, it has how to apply, it has the eligibility, it describes the application process, it has all of the times. It helps explain what does it mean to be 60% AMI. It explains, all of the different requirements. So feel free to spend time on this website. There's also a way people can look up their address to make sure they live in Harris County. There's a contact form, etc. We will continue to be updating this website throughout this week to continue to provide more information, including, the sample application. It's in multiple languages. That's the other thing at the top. Allison was showing you right there. It's Chinese, French, Spanish, Vietnamese, or English. And we'll put the website in the link in the chat box, Stephanie, or someone, if you, it's harriscountyrelief.org. So just know that that is your best place for information, is the website. Let me turn back now to the presentation document, and we're going to go through some of this in more detail, but I just want you to know the website is a great resource. So the timeline that we had from the county was very aggressive. We had 75 days in order to make sure that all the money had been spent by the individuals receiving it. So we've spent the first couple of weeks on the phase 1 grants. So those have been dispersed. There's one more going out, I think today or tomorrow, but almost all of the grants went out on Friday, and I'll talk in a minute about that process. We're going to spend most of our time talking about next week, Tuesday and Wednesday, which is when public intake will be happening. By Friday the 26th, we'll communicate all the public intake matches. And then by July 31st, all funds have to be expended by grantees. Now, we actually expect the funds will be spent much, much faster than July 31st, but we're giving people a little bit of time to get there. Moving on. So this is the eligibility requirements. This is all on the website, plus we'll be sending this to you, so don't feel like you need to take any notes. Simply, the person must be a qualifying applicant by living in Harris County. So there's multiple ways they can show us that, and you see them all here: a driver's license, an ID card, a matricula consular, a valid ID card, school ID, nonprofit membership, US visa, work permit, union card, foreign government, office of resettlement. you know, and then if they have something like that, we also need to see a utility bill or a phone bill, which could be cell phone or landline, or a postmarked mail with name and address. If they are a domestic violence survivor, a youth who's aged out of foster care, a human trafficking survivor, or homeless, then they can just have a certification, basically a self-testimony saying, I live in Harris County, I've been homeless, and that's all. In order to show that they are below 60% of AMI, and they do have to have been below 60% of AMI before March 11th, again, if they're one of these other special categories, they don't have to meet the 60% of AMI. Everyone else can either use proof of public benefits, and you can see the long list of public benefits we included, including our own Harris County Gold Card, or copies of their annual wages through tax returns or W-2s, or monthly wages. And again, they could have a declaration of income statement. So if there's somebody who's undocumented and does not have any other wage stubs, they're not going to be excluded from the process. They're supposed to self-certify that they have had some kind of economic impact, and they're supposed to self-certify that they didn't get money from the City of Houston Baker Ripley Rental Assistance Program. We all know there's so many people in need, and the county really wanted to make sure they were helping people who had not already received assistance. So again, all of this eligibility information is on the website. And it also is in an outreach packet, which we'll be sharing with you as well in multiple languages. But that's the basic eligibility. And the format for self-declaration of wages, I see you're asking that. That's something that the nonprofits will be working on with them. So we'll talk about that in a minute, but nobody has to provide any information like that when they apply. It's after they get matched to a nonprofit. Let's move to the next slide. So we are really committed to not making this a first come, first serve process. What does that mean? That means that the reason why we developed a two-step process was that we first wanted the nonprofits who have wait lists, who work in our communities, who have programs that people already participate in, to have a chance to serve people with the greatest need. Second, when Elena gets to talking about the public intake process, you will note that we're also using a different way of selecting people that takes into account social vulnerability. So the Social Vulnerability Index, which the CDC created years ago, many of you may be really familiar with it, but this could be new for some of you, so I just want to briefly touch on this. This was really designed to help local public health and recovery response officials understand the social and economic needs and conditions of neighborhoods after a disaster or public health crisis. So census tracts within Harris County, and we'll look at the map in a minute, are rated in different quartiles of social vulnerability. Those ratings are based on all these factors you see here: socioeconomic status, household composition and disability, minority status and language, housing type, and transportation. So moving to the map, you'll see that in Harris County, the Social Vulnerability Index, and again, this is not something GHCF or any local party developed. This is the CDC. This is a nationally recognized policy-making tool. The county used it before in their flood buyout program, and we're using it again for this. So the quartiles, quartile 1 is least vulnerable, quartile 4 is the most vulnerable. So we're using this in a few ways. First of all of the grantees, the nonprofit organizations who will be working with the people seeking assistance, are told to prioritize people living in the more socially vulnerable areas. So if they have to choose between Stephanie and I, we're both 60% AMI, and there's a limited amount for them to serve in this first phase. If I'm in a more socially vulnerable area than Stephanie, then I'm supposed to be chosen. So it is a way of weighting people even in the first phase of assistance. And then Elena will talk about in a minute how we're using it in public intake, because we're using it in a very specific data-driven way to ensure that people in more socially vulnerable areas have a better chance of getting help. Next slide. So I'm going to stop for Q&A now. I do want to say the public intake process is the next part we're going to be talking about with Elena. One thing I forgot to say in the beginning is that we did study what other cities, counties, and municipalities were doing all across the US to try to learn from them. Because we had this focus from the county on equity, on serving immigrants, we've been able to learn a lot from other cities and other communities. And so as you hear what we're doing with public intake, hopefully that seems reflected. So Stephanie, do you wanna, are there any questions right now in the Q&A box that we need to respond to? And then if not, we'll ask people to start raising their hands and Alicia can unmute people who wanna ask questions.
No, I've responded to some in the Q&A, and it just reiterating that we will share the PowerPoint and video following the webinar.
Okay, great. So Alicia, is anybody raising their hand? Because I can't see that.
Nope, no. Oh, we just got a couple. Hold on just a second.
Okay, great.
Hi, this is Mickey. I am working with the Texas Advocates for Justice. So I just had a question about the map that you just showed. Is there like a website link that we can sort of like, is there like an interactive map where we can explore those areas like a little bit closer?
Yes, that's a great question. So the map will actually be on the website and people will be able to put their address in and see whether they live in a census tract that is socially vulnerable, but we also have an interactive version that we can send that shows which zip codes are in each census tract. So we can make a note of that and send that for sure. Other?
Hi there. Can you hear me? Oh, hi.
Yes.
Hi. So I did get the answer to my question. A CBO is a community-based organization. So what types of community-based organizations are you talking about? Nonprofit?
Yes. Yes. And in fact, Allison, can you go back? Where's the grantee selection slide?
I lost Wi-Fi for a minute, so.
Okay, give me 1 second. I'm trying to get us to pull up a slide that describes how we chose.
You may have talked about this, and I may have missed it.
No. It's right here. So I mentioned that we have already selected the grantees, the community-based organizations who are doing the actual emergency financial assistance. So here's the criteria we used. There's 44 organizations that are participating. We'll be able to share that list later this week. We have to share it actually with Harris County first as part of our contractual requirements, and we had one final grantee who needed to sign a document. So we're hoping we'll be able to share that with the county tomorrow afternoon, and then we can share it later in the week with this group and others. But the way we selected the grantees, they have to be 501c3s. First of all, they all have to be 501c3 organizations in good standing. They have to have the capacity to effectively conduct outreach with vulnerable populations. They have to have the ability to serve Harris County residents in multiple languages. They have to have a proven track record of providing emergency financial assistance during disaster or a pandemic. They have to be committed to serving residents in socially vulnerable census tracts. They have to have quite robust financial reporting capacity. They had to have willingness to participate in the Harvey Home Connect universal application and intake process, which we'll talk about in a minute. And they had to have compliance with a lot of other Harris County legal requirements. So I'm not going to go through all of those with you because I don't think it's relevant, but it's around data and record retention, having insurance, a lot of other things. Of the 44 organizations that are participating, 42 were grantees of the Greater Houston COVID-19 Recovery Fund. The positive of that is that we already have been able to see their track record of providing financial assistance in the community. They've already been able to do so in an effective, quick, and culturally competent manner. There are a couple of other organizations that were added that have served the community for a long time in other capacities. So really, when you see the list of organizations, you will note they're not all large organizations, they're not all small. They're a wide spectrum of nonprofits who have the capacity to serve people in multiple languages, have been doing emergency financial assistance for some time, and they are geographically very diverse. So we tried to include as many grassroots organizations as we could that had the capacity, while at the same time, due to a lot of the contractual obligations of the county, there were some things that were really important for us to take into account in that decision-making process. Do we have any other questions right now before we go to Elena's part on public intake?
There was a question, Renee, I'm trying to catch up on here, about people who received the CARES Act. Are they eligible to apply? And I thought I saw another similar.
Yeah, I mean, we have said that the eligibility is that they should not have received CARES Act in order to apply. But it is going to be a judgment call in the sense that if they're in a very socially vulnerable census tract and they have a lot of other barriers like additional disabilities or a very large household size or something else, they're not excluded, but the preference is to serve people who have not received the CARES Act before serving those who had. And the same question is being asked about government stimulus. Government stimulus and CARES are the same thing. So the goal is to serve people who have not received that, but there will be some who get it who have. Anything else, Stephanie, that should be responded to right now?
Not that I see.
All right, I'm going to turn it over to Elena. We've got a lot more time for questions, so keep sending them and feel free to keep sending them in the chat. Elena, you're up.
All right, perfect. So I wanted to, as Renee just said, this is a two-step process. So the first $1 million of the 30 million of grants went to grantees, really start serving those within their reach, people already on their wait list, or people that they're doing outreach to in their communities. The other 15 million is going through a public intake, and that's what we're about to walk through. Could you go to the next slide? Actually, I think we're a couple of slides. Alicia, we went back. So if we can go forward here. Okay, perfect. So first I'll just introduce, my name is Elena White and I'm the Executive Director of Harvey Home Connect. We're branding to Connective, and we are a disaster response and preparedness system. We provide coordinated recovery for communities in need, and do so through building common intake and application processes, coordination for nonprofits to work together, and data analysis that really helps illuminate gaps in services across geographies. And we do this in the Houston area. As our name says, we started after Harvey, because after Harvey we really noticed, at the time I was with a consultant with the Greater Houston Community Foundation, there were a lot of new resources for people to be served who were affected by disasters, a lot of people who needed the resources. To people actually receiving resources. And so that, as Renee said, is they own the contract with Harris County. This is a Harris County relief fund, and all of the oversight and decisions that come with that. They also run the grant making process and selected those community-based organizations. They also own the messaging and outreach through partners. Our role is really providing some best practices on intake from other disasters and national research we've done, and building and managing the website, the intake forms, and the software systems that coordinate services. We're also overseeing text messaging outreach to vulnerable communities, which we'll go through in a bit. So we're some of the back end that helps make this work. And as we building out that intake and applications, we're focused on 4 goals, which we have been focused in all the disasters we've worked on. Goals are accessibility, so making sure that it's accessible to all. Customer service, making sure that people have a good experience, that they know the status of their applications, that they are contacted in a timely way, transparency, and that is around providing aggregate data to really demonstrate the impact and drive continuous improvement, get better where there are any gaps in services. And then the fourth is deep engagement. So we've been really building this out with the nonprofit community-based organizations, had a series of design sessions and lots of one-on-one touch points with them to build this out. All right, next slide. So we really try to root what we do in human-centered design. We've conducted focus groups over the last couple of weeks to really understand of people impacted financially by COVID-19 and get their input on this process. And we've also been holding, as I mentioned, design sessions and one-on-ones with our community-based organization partners. Go to the next slide. Okay, so how does this public intake process work? So first, there's of course outreach about the public intake. Renee shared with you all the website. In addition to that website, we're doing text message outreach to people in socially vulnerable census tracts. Share that in a bit. And then at the end of this conversation, Renee will talk to you all about other outreach efforts and how you all can participate in that. The next step is on the days that the application is live, which is June 23rd and June 24th, people can apply online on that same website that we shared earlier, or they can call into a multilingual call center. So that call center will be open 8 hours both days. We've staggered the times to make sure that people are able to call in regardless of their work schedule. Okay, so at the end of the days, we're expecting to receive tens of thousands of applications. As you guys from earlier in this presentation, there's 15 million of funding to distribute as a part of this public intake. So that, so that really that 15 million of funding will help about 12,000 families. So, but we're expecting that days, based off of other cities' experiences and even other experience, here in the city of Houston and Harris County, we're expecting that we'll receive 50,000 or 60,000 or more applications than we can than the funding will provide. So at that point, we will do a drawing of clients to select the 12,000 who will move forward. It will be a randomized process, but we're going to give additional weighting to people in socially vulnerable census tracts. And I'm going to talk through how that will work. At that point, we will match the 12,000 moving forward. We're going to match to the community-based organizations based off of their geography, the populations they specialize in serving, and their capacity. And those agencies will then work with the client to collect documents and verify their eligibility and then provide them assistance. Okay, the next slide. So I mentioned this text message outreach. So there's a lot on this slide, but essentially we're working with a vendor who's done a lot of census work to send out text messages to people living in the most vulnerable tracts. So we'll be sending text messages to approximately 95,000 residents living in vulnerable census tracts to make sure that they get the word out about the public intake. If we go to the next slide. Okay, here I just want to do a actual demo of the intake form. We designed this in a way that we think is very easy, is simple. The first thing I'll point out is there's documents need to be uploaded as a part of this intake. process. So we wanted it to be low barrier to get in, and we recognize that people, not everybody has technology access, and even uploading a document from a smartphone can be very difficult. So there are no documents required to submit an application. The document and eligibility, the document collection will happen further down the line. So at the top here, we're just collecting the contact information for the client to make sure that we're able to reach out to them about the status of their application when we match them to an agency. We're collecting their preferred language, and this will be available in multiple languages. The number of people in the household, birth date. So we're actually collecting birth date because we're trying to really limit the amount of personally identifiable information that we collect. And this is actually allowing us to create a unique identifier that helps really really keep a lot of personally identifiable information out of our portal and database. Next, eligibility. As Renee said, there's on income, there's really either two ways you can be eligible. Either you qualify for one of a long list of public assistance programs, or you're under 60% AMI. So the first thing we ask is what a household member is eligible for in receiving one of the following public assistance programs. So perhaps I have a kid in Head Start. If I check one of these boxes, I'm not asked anything about income. If
Elena,
nobody in the household.
Elena, sorry, real quick. There's some buffering, so sometimes stuff you say isn't getting through. So I just want to reiterate. If you check one of those boxes that you're participating in a program, then you do not have to provide any other income verification. You faded out when you were saying that.
Thank you, Renee. I appreciate it. So then if you are not disclosed you receive any of these benefits, or if no one in the household is enrolled in a public assistance program, ask if your income is under 60% AMI. And this annual household limit is calculated based off of your household size. So 60% AMI really differs based off of your household size. So this is calculated based off of that. And at that point, it asks, was the income less than the amount shown above before the impact of COVID-19? The next eligibility criteria, as Renee said, is that they need to have been economically impacted by COVID-19. That's a very broad definition of economic impact. It could be that they lost a job or lost wages, but it also could be, increased cost burden or difficulty maintaining housing. The next section is really around who they'd like to work with. So if they already, if they have a preferred organization that they'd like to work with, we then allow them to select that organization. Okay, and again, those are one of the grantees that the GHGF selected as a part of. If not, we then ask if they'd prefer to work with somebody who specializes in serving one of the following groups. We certainly are, through our focus groups, that people, people would like to work with agencies that have experience working with them, or with agencies who have staff that speak the language they feel comfortable speaking. Finally, it's certifications that this information is correct. So that's really all people need to do to apply, and either they put it on the website, or one of anybody at a community-based organization, or an advocate of that family could help them apply, or they can call into the call center, which we will have available for 8 hours each day of the public intake. Renee, is there anything that you want to add on there, or any other portions I cut out on before we go to the next piece?
No, I think that's all. A lot of people were asking whether they could get access to this information, and yeah, it's all in the outreach package we'll be sending afterwards.
All right, so if we go to the next slide, how people will get selected to move forward. So as I mentioned earlier, we're expecting to receive a lot more applications than there's funding available. So when the application closes on Wednesday, June 24th at 10 p.m., all the applications will be put into a drawing and randomly selected. However, those from more vulnerable census tracts will be prioritized through weighting. So those quartile of vulnerability, 25% most vulnerable census tracts, they will a 50% increase of being selected. Those in the next most vulnerable quartile, so those in the next most vulnerable 25% of census tracts will receive a 25% boost, a 25% increased chance of being selected. And everybody else will essentially get their names put into the drawing one time, okay? So if you look at this map, and as Renee said, we have a link that we can share out of this map, and it's also being added to the website. The two darkest red census tracts, those are the ones that will get some additional in weighting. And I know I've talked to a couple of you all on this line about this to get feedback as a part of this process. I know from those I've talked to, so there's a real desire to prioritize people who are vulnerable. And again, we're using the social vulnerability index that Renee shared earlier to do that. So that's really all I had. Any questions on this part of the public intake?
Yeah, and any other questions in general, we're going to talk in just a second about if you want to help us, how we think you can help us, and we want to hear your ideas as well on outreach. But as you can tell, this is a really different process in terms of the weighting for social vulnerability, and we're going to do our best to communicate that really transparently on the website through press releases and all the outreach materials. We want everyone to understand what we're doing, and we want you to understand it obviously as well. But questions about the public intake process before we talk about outreach for Elena or for any of us?
There are a couple in the chat, and we can see if folks want to raise their hands. Will there be a soft copy of the application for printing?
Yes, it's going to be attached to the outreach packet. And it's also going to be downloadable on the website in terms of a sample.
Where are we getting the numbers from for texting folks, and is the texting in multiple languages?
The texting's in English and Spanish, and it's coming from a strategist who was able to get verified numbers for census tracts, for the most socially vulnerable census tracts.
How do we ensure parity in the matching? So it says if they select a few agencies and these agencies are inundated with applications while some other agencies have very few clients, how do you ensure parity such that the agencies with few clients can get more clients?
That's the beauty of having a system that has all the data. It allows us to help do that, but I'll let Elena speak in more detail.
Yeah, that's a great question. So, so really we went through a lot of steps. Our last design sessions with grantees to really explain to them each how this is working. But essentially what we're going to do is first, we're going to look at who the clients said they want to work with, right? So there's going to be a certain number of clients, maybe 30%, for example, of people who will actually pick a preferred organization. I think the majority of people, will not pick a preferred organization and perhaps will just pick some preferences. So first we will allocate based off of who the people who have, the 30%, let's say, who have listed a preferred organization. Then we will go
Okay, Elena froze, and so let me pick it up from here.
Okay, I don't have a preferred organization, but I'd like to work. You can't hear me?
Now we can. You froze for a second.
Okay. So then we'll go to the next group, which is people who did list a preferred organization, but they said that they want to work with an agency that specializes in a certain population. So let's say I say I'd like to work with an agency that specializes in serving Vietnamese speaking individuals. So next we're going to go allocate all of those to agencies that work with those specialty populations. And then finally, we're going to look at just capacity of the agencies by geography and allocate the remaining. So that's how it's going to work. Capacity is going to be a part of that matching process. And so there won't be an agency that can only handle 200 clients that we end up sending 1,000 clients.
Yeah, and I would just say on top of that, you know, the 44 current community-based organizations, 501c3 nonprofits that are serving in this capacity, we will be checking in with all of them, and we'll have live data on how they're doing, how many people they've already served, are they running into any constraints, et cetera. So it's a very thoughtful process. The matching will dictate how much funds the organizations receive for public intake. If we may have anticipated they would serve 500 people in phase 1 and 500 after public intake, but if they don't get 500 matched, then they won't receive funding for that. I did see a question about why weren't other organizations who provide assistance invited to this webinar? This actually was not a webinar for organizations who provide assistance. This was a webinar for advocacy and community-based civic engagement organizations. So we've been communicating to the organizations that provide food and financial assistance all the time because they're our grantees. So we were really trying to reach a little bit different set of organizations with today's information, but you're welcome to circulate the information to any organization in the community that you think needs to hear it. But certainly we've been in touch with the traditional organizations who provide food and financial assistance really regularly. What else is in the Q&A or the chat that we should answer before we go to outreach? Do you see anything, Stephanie?
I do not.
Does anybody want to raise their hand, or should we go to outreach? We have one live question. Okay, great. Who's the live question?
Good afternoon, everyone. Can you hear me? I just want to make sure you hear me.
Yes, we can hear you. Go right ahead.
My name is Azeb Yusuf, and I work with BBZ Wellness Center. Since COVID-19, I've been diligently working in the ground zero with different organizations. You have answered a few of my questions already, but one of the issues that I have seen, I can give you my own personal experience dealing with Hurricane Harvey crisis in my own house. I'm still having to struggle if my house is not fixed at all. I've been tossed around to different organizations who are very respectful here in Houston. I've been saying, oh, we ran out of funding. Then I'm transferred to another organization. My question in regards to the new merging organization who are doing fantastic job in the ground zero since COVID-19 by supplying food, a shelter, financial assistance. Several of them have worked with me diligently. And we do provide services to diverse community. My area is healthcare, making sure everybody have access to healthcare and testing for COVID-19. But in terms of social services, they are really, really great organization here in Houston. They are newly merging, and they are spending their own money to make sure people are not hungry. So I just wanted to say that give this opportunity and look into this organization and their work. One other thing I wanted to mention is I always see that funding is allocated, funding is provided, but once the funding has been dispersed, is there any way anyone can go back from the organization who's dispersing this fund, looking at how many people have been served? When was the last time we interviewed the client like myself? Nobody came to interview me and ask me for my experiences, but I can tell you it was not good. So outcome, we need to see the outcome measure, not only just giving funding, but what have we done? How many people we have served? It's not only numbers. We really need to talk to the actual people who have been helped. And that's all I have to say. And thank you for the opportunity.
Sure. Well, thank you for sharing your experience. I'm sorry that the experience with Hurricane Harvey and rebuilding was so painful. We know that unfortunately, not everything was done well in that experience, and we've had a lot of difficulty, particularly with government-funded programs not working with home repair. We're certainly open to learning about new organizations. We've had a process of actually 500 nonprofits have submitted information to us that are working on COVID-19, and we've reviewed all of them. It's not always possible to fund everyone, but if there's an organization that you think we need to know about, feel free to put it in the chat and we're willing to look at it. We're absolutely committed to transparency and accountability. So every organization that we fund has to provide reporting on the number of people served, you know, really detailed information about how they were served. Part of the reason why Elena's team has been doing focus groups is exactly to hear these kind of concerns. We also are hoping that Texas Policy Lab will be able to do a follow-up impact study, talking directly to people who received the assistance to get a sense of how they were helped and how it impacted them. So, you know, obviously we're all in this work because we really care, and we're trying to make the experience as low barrier and as good as it can be for people who are receiving assistance. So appreciate that it's always difficult, and unfortunately there's always going to be more people than we can help, but we want every agency that we fund to be treating people with dignity, with respect, to be doing their work quickly, effectively, and in the most human way possible, and we're certainly interested in that feedback loop. I think we have one more live question and then we should move to outreach because we're going to be out of time. Do we have that live question? Yeah.
Hi, can you hear me? This is Dawn. So I have a quick question. I'm trying to do this webinar on my phone, so I apologize. I'm missing something, so I'm certain this has been covered.
That's okay.
I'm missing just the basic information about where would the phone number be that people can call in on the 23rd and the 24th, and what's the website link to apply on the 23rd and the 24th? How will we get that information? I don't think we are a participating organization, of course, but we serve, this is Casa Juan Diego, we serve, you know, strictly the unauthorized community and new immigrant community. So we want to just make sure I can hand out a flyer, and we really need to do that fairly quickly. We're happy to make all the copy, do all the work to get it out, but I just want to make sure I have the correct information.
Sure, it's harriscountyrelief.org, and I think it is kind of inhibiting you that you're on your phone because we've posted a lot of stuff in the chat, but we're happy to send it out afterwards. So it's harriscountyrelief.org. We'll be releasing the phone number in the next couple of days, and so everybody will get that information. Okay. So let's go to the outreach information, the next couple of slides, because we're running out of time, and so I want to make sure we get to talk about this. So like we've been saying, we've got outreach packets available. They're being translated into multiple languages. I think we have English and Spanish already, and we're waiting on Chinese and Vietnamese and several other languages. We're doing it in 10 languages, but we'll have those via Dropbox that you can connect with, and you can get them, you can circulate them, you can print them, do anything you want with them. We also would love to see if you want to partner with us in other ways. So some of the ways that we think could be helpful is getting the word out via social media. If your organization happens to have a lot of social media followers, that would be great. If you are an organization that has a strong membership or affiliate list and you want to consider calling your membership or texting your membership, certainly you could do that. If you're the type of organization that wants to help people fill out the information on the 23rd and 24th, either remotely or in person, we know most organizations are socially distancing, and certainly we don't want anyone to put themselves at risk to help someone else. But however you would feel comfortable doing that. We will have a lot of PR and media events going on. Commissioner Garcia is doing an event on June 22nd with Telemundo that I'll be participating in, and there may be others where there's sort of live events going on. Let's go to the next slide. So Rachel, did you want to speak a little bit to this about what all is going to be in the outreach packet? Rachel, are you there? Okay, somehow Rachel's not here. So this is, apologies. This is what's in the outreach packet. It's got the eligibility and documentation. It's got the FAQ. There's social graphics for to use for Facebook, Twitter, and Instagram. There's an application example, and then it's provided in 11 languages. So we'll be sharing this afterwards. And again, you can get it via Dropbox, and we're happy for everyone to, use this and distribute as widely as you possibly would like to. Can we go to the next slide? So for those who want to participate, certainly we know everyone will not want to, but if you want to participate, we'd like to try to see if we can schedule a weekly meeting a meeting next week and possibly a meeting right after outreach ends in public intake in order to get feedback about how it's going. We have some very limited funding available to support outreach. So if your organization is interested in participating in outreach and you believe that you need funding to do fund banking or print flyers or do text messaging, if you're a 501c3, then we can provide you limited funding to do that. We'll be sending out a Survey Monkey that you would have to complete. It's going to be a pretty simple questionnaire asking what the nature of your list is, when the last time was that you used that list, so we know if it's actually, you know, something that's been verified in the past 30 or 60 days, asking you what kind of outreach you would do, and whether or not you would participate in the feedback loop. And if you answer positively to all of those things, then we'll consider funding. I should say it's a really nominal amount of funds because we're talking about like a 5-day period. So it would be a few $1,000s potentially that would help defray printing costs or support the cost of texting or phone banking. So we will send that Survey Monkey out to everyone who participated and gave their name in the beginning in the chat of the organizations. Unfortunately, if you're not a 501c3, we don't have the capacity to fund anyone who's not a 501c3. But those are the things that we're talking about, and I'll just open it up for questions about the outreach and just any other suggestions that you have. I mean, basically, and you should think the way we're thinking about it is that our outreach, and Rachel, if you want to speak up, feel free. It's sort of multiple parts. We've got our website. We've got.
Yes, Renee, I'm here.
Okay. Do you want to? I talked about the outreach packet a little bit, but what else would you like to say?
Yes, and so we're in the middle of translating everything, and so we'll have that, just as Renee said, we'll have a Dropbox link for you. We currently have English, Chinese, Spanish, Tagalog, and Vietnamese available. We should be able to get the other languages here shortly in the next day or so. But all of those things, including eligibility and documentation, they're individual PDFs. And then for social media graphics, we really encourage you guys to post on your social media platforms, and all of those are translated as well for you. And then I think somebody said if there was an application to print out, we will have examples of those in each of the folders for the languages.
Great. So, so just to recapture, we have the outreach packets, we have the website, we have the call center. We'll be doing a lot of social media. All the county commissioners' offices will be doing social media. We have the outreach through text. Certainly, if there are other ways that you think you can help us, we're very open to that. We know it's a short time frame and everyone is busy. We're not going to have difficulty getting people to apply. Unfortunately, we'll have thousands more people who apply than we can help. But the real point is that we want people with the most barriers and who are the most vulnerable, who haven't received other assistance, to apply. And that's really why we need your help. So we're getting asked about Swahili. We can look at it. It's not in the top 10 languages, but that doesn't mean that we can't look at how to provide it. So we're doing all this based on data, but any information you have about a couple of other languages that need to be added, we can take that into consideration. It is important to note the application on the website through Google Translate actually can be done in any language, so that shouldn't be a barrier. Other questions about outreach or ways that you think you might be able to help? If you want to receive the Survey Monkey survey about participating in outreach and possibly receiving funding to support that, then we should make sure that you have given us your name and your email. We did send this invite, obviously, to a number of organizations, but we were really happy that many organizations, Houston in Action, Houston Immigration and Legal Services Collaborative, and others also spread the word widely with their memberships, and that's great. We want as many people to know about this as possible, but just make sure you entered your name and your organization's name and email at some point in the chat so that we can send you the information from the webinar, the Dropbox link, if you're interested in potentially being an official partner, then I want you to be able to do that. We could take, it's almost 2 o'clock, but I'm willing to stay on for a few minutes. Is there anyone who wanted to ask any other live questions before we get off? Anybody wanting to speak up? Anybody? It looks like right now everybody's just sort of sending their chat information, which is great. We greatly appreciate it, and we'll give some more time for that to happen. So yeah, we will, this is being recorded, so we will send you all the recording. Let's see, we have some questions in the Q&A. Stephanie, are there any questions in the Q&A that you could answer, please?
That I can ask. It looks like Katie Atkis asked if the City of Houston Rental, Harris County Utility, and Harris County Forgivable Loan Program distributed comparable amounts of funding per family that we are, the 1,200 and 1,500.
You know, I don't know the answer to all of that offhand, Katie. I do know, I want to say the Baker Ripley assistance, I want to say was 1,200. I don't know. I don't remember what the utility assistance was. We came to the decisions based on average rent and then adjusting for household size. So 1,200 is like the average rent from Harris County, but larger household size needed more funding. So that's how we came to it. I'm not 100% sure about what everyone else did. Is there another question?
I think most of the others have been answered live. Let me see. Will it be the same organizations that received funding in phase 1, assisting with the applications in phase 2?
Yes. Yes.
Okay. Yeah, it looks like most of these have been answered live. I'm trying to make sure I didn't miss any. So please raise your hand if you do have a burning question, or maybe retype it so it can go to the top of the list. There are quite a few in here.
Okay. Great. Well, we certainly appreciate everybody's participation. We participate all the thoughtful questions. We appreciate the concerns. I think there was a question somewhere along the way about the diversity of the organizations that we have granted to. We're proud of the organizations that we chose. There are organizations led by all types of people, African American, Hispanic, Asian. We're very committed to promoting diversity in organizations. So someone asked about that, and we can certainly share that information afterwards. We just didn't have the numbers in front of us. So we certainly are not trying to hide who our grantees are or the leaders of them. Someone asked, is there an email template we can use to share with organizations? Yes, we can work on that. If there's something that you feel would be helpful in terms of sharing the FAQ or something like that, yeah, we can come up with an email for you. I think we're going to sign off unless I see any other questions. And certainly all of you received the email to participate. You'll be getting follow-up information, but you can respond back to Natasha, who sent you the information. We have one live question. Okay, we'll take one last live question. Go ahead.
Hi, this is Katie Atkis. Thank you for answering my question about the amount for the other assistance programs. I just asked because receiving money from these assistance programs disqualifies you. So I was wondering, like, you know, I don't know what the rental assistance program, utility assistance program, I'm sorry, offered, but if it was like $60 and then because you got $60, you missed out on the potential to get $1,200. So I was wondering how closely you guys looked at that.
We looked at it, and honestly, it was the county's decision at the end of the day. So, you know, we'll take responsibility for how we're administering the program, but we also had to negotiate with the county. And so there are some things that people may not like about the program, and some of that should be directed at the county, any of those concerns. Certainly the nonprofits are, I think, very good at looking at needs. No one is going to get disqualified because they got $60 from another program. So that's not the intent. The intent is if they received rental assistance from the City of Houston Baker Ripley program, that would have been $1,200 or $1,000, and that is significant. And I will just say, these are really difficult times. They're heartbreaking decisions to make in terms of who we help and who we don't. Everybody takes that really seriously. We're doing our very best to promote equity and make sure that people who are vulnerable are getting help. But we also know it's going to be heartbreaking, that there's going to be thousands of people who apply who don't get through. We're committed, though, to having a more open process anyway, because the reality is that that data is important for the whole community to know how many people have those needs. but no one's going to get disqualified because they got $60 in utility assistance. So you can take that worry off your list. Certainly our community-based organizations understand that that is not the way that this was meant to play out. All right, any other questions? I think out of respect for everybody's time, we're gonna wrap up. Thank you so much for participating. We really, really, really appreciate your interest, your time. We know it is a lot of information to take in. Really encourage everybody to go to harriscountyrelief.org. There's so much good information there. We're gonna be in touch with all of you. Again, we appreciate the work you do on behalf of our community every single day. You make our community stronger and better and more fair, and we really appreciate you. We hope you stay healthy, safe, and well, and we will be in touch. Thank you so much.